Convalescent plasma is basically if you take your blood and you spin out the red blood cells, it's what's left over. So it's the white blood cells, it's the antibodies, it's all the other components that make up our blood minus the red blood cells.
Okay. And why it's been useful or believed to be useful in some coronavirus patients?
So, initially started using convalescent plasma actually in history when we wanted to treat people for conditions for which we did not have vaccinations. Because when someone has contracted a condition, recovered from it, developed convalescent plasma, giving it to somebody else is almost like giving them their antibodies and therapy. So, because it's worked like this in the past, and the coronavirus is a novel coronavirus for which, we don't have many effective treatments, this was tried as an experiment. And early on, the first paper that was published was in March of this year, which was in 5 critically ill patients that were given convalescent plasma, and they had clinical improvement. Now, of course, that was a very messy study because there was no control arm, so it wasn't clear that the convalescent plasma did anything or whether it was something else. So it was hard to tease out the effect of the convalescent plasma. Now, since then, we've had some subsequent studies that have shown some potential for promise, but the totality of the data yet is not convincing enough that scientists feel that it warrants emergency use authorization.
What is the FDA saying right now about where we stand with plasma?
So the FDA was reviewing an EUA, or emergency use authorization, for convalescent plasma. And Dr. Fauci and other health experts advised caution in approving that EUA for convalescent plasma for a few reasons. The first is because, as I said, the clinical trials have suggested some benefit, but it hasn't been statistically significant. So the question remains whether we just need more patients in order to figure out whether there's a clinical benefit, or whether there really isn't a clinical benefit that's mathematically significant. The second reason that the EUA was potentially put on hold was because, in order to answer that first question, we need to have ongoing randomized controlled trials. We need to get people enrolled in trials. If this plasma receives EUA, it's going to actually affect the enrollment of these randomized trials, because people who are looking for convalescent plasma as a potential therapy may not then enter the trials. They'll just get it from their doctor anyways. And so it might decrease the enrollment in the clinical trials, which we really need in order to answer this question definitively.
What is going on with the FDA does not prevent a doctor, though, from still using this, or people from donating this, because that's still happening. People have been encouraged by that. People want to try to help in any way they can, so they're going to donate. That's all going to keep going on in the meantime.
Yes, in fact, I would encourage you to continue to donate, because part of what we need to do is really finish investigating the science. And in order to do that, we need convalescent plasma. And furthermore, what we're seeing from this clinical studies is that it may not be just as simple as whether it works or not, but it might be how when you give it. So if you give it within 3 days or after, and it might also be how rich in antibodies it is. So remember how we've talked about everybody having different antibody responses. So that plasma that tends to have more antibodies actually seems to work better than the plasma that doesn't have as much antibodies. And so without donating, you'll never know if you're one of those people that has extra antibodies in their plasma. And so these are all really important, outstanding questions that you can help to answer.